TopMedTalk.
Well, hello, and welcome to TopMedTalk. This is Desiree Chappell, and I'm coming to you from Louisville, Kentucky. I've had the opportunity to catch up with a good friend of mine, Rob Martin, who's the Chief Operating Officer of WAVi Co. Rob, good to see you.
Nice to see you, Desiree. Pleasure to see you. It's been a while.
Thanks for flying into Louisville, Kentucky.
It's great. A little cold out, but otherwise, very beautiful town.
Yeah, well, unfortunately, you're seeing it at its worst. Louisville, Kentucky in the middle of December is cold and gray and nasty. And that's why we have a lot of seasonal affective disorder, I believe. But anyway, well, Rob, we've been friends for several years now, and you are into a new company, and I was wanting to hear a little bit more about some of this new technology that's on the market now and available for providers here in the U.S. Why don't you give us a little bit of background about you and then about WAVi and what it is, and we'll go from there.
Sounds good. So as you know, I've been in medical device for about 20 years, a little over 20 years in both sales and marketing roles, leadership roles. And I ran into this company about 3 years ago, and WAVi has really changed my life. What we do is very unique. We measure cognitive performance. Typically, we measure things from the neck down, right? So we look at blood pressure, heart rate, blood panels, height, weight, all those things. But when's the last time you've had your brain scanned, brain measured? Typically, you're either injured or you're sick in the hospital getting an EEG, which is what we do, evoked response potential. And we measure some simple markers that you probably are not going to be able to pull out of an EEG waveform. We're going to give you brain reaction voltage. We're going to give you the brain reaction speed. And we're going to give you a physical reaction. So those are actionable items because the voltage acts like as the brain's battery, right? So how much energy can we devote to an uncommon tone? So when you went through that test, it's an auditory test. You heard a series of tones, and then you heard a high-pitched tone, and you responded. You physically responded with your finger on the mouse, but you also we captured in 19 different positions of your brain, because this is a class 2 medical device. We captured how much voltage you have in your brain, and you have a beautiful brain. I'm looking at the results right now. Your brain reaction time is actually in the high norm as well. And so those are what we do. We measure cognitive performance. And so the great thing about it is the brain is resilient. And if you have a measurable baseline to start with, can you do certain things in your lifestyle to improve that? So now for the first time, we can really, in a very affordable, and you saw how fast it took to get going. It doesn't take much to set this up. 4-minute test for roughly $40 a test to the practitioners that are out there.
It's super cool. So just to give our listeners a little bit of background, Rob came in and brought this medical device called WAVi. And Rob, you were telling me a little bit about the material that it's made of. It's an EEG headset. And it is, what material is it made from?
It's made of the Crocs-like material, the Crocs, the shoe, the goofy shoes that were sold all over the world for many years. The Crocs founder, Scott Siemens, is the reason why I'm involved with the company. He had a chance to work with our founder and CEO, David Oakley, and it has a Crocs feel to it. So it's a very lightweight rubber antimicrobial feel. They also took it to some friends, his friends in Italy at Momo Design, and they designed all the Ferrari helmets. So there's some great architecture in this headset, even though it looks very light. It almost looks like a mountain bike helmet, but it is a class 2 medical device.
Yeah, so it looks like some weird kind of alien thing sitting on your head, actually. But it's super comfortable, and it is something that you can use on different patients, multiple patients. It's not, you don't have to get a new device every single time. And so you put this little headset on, and you do the testing you were talking about. And is it the same test for every single patient?
For the most part, yes. We're always going to give you the brain reaction voltage, the speed, and then the physical reaction, but we can break it down into very complex forms where we're looking at coherence. We can get into anything that a neurologist or any neuro-based physician would want to know. We can get down into the weeds with that. The report that you did right there is the performance report, which is for the masses, for the main population that typically doesn't measure their brain and is not sick or injured. So they just want to improve their lifestyle.
So what you get is kind of, you show me, it's like a speed test almost that you see and show, and you have the different values there. But if there was a professional that really wanted to look at the EEG, you do have raw EEG for them, right?
Correct. So you'll still get 4 minutes of raw EEG data right there. Absolutely. Every one of the scans has that.
So you said Dave Oakley started this company. Tell us a little bit more about the history of it.
Yeah, so Dave has just done a great job of collecting some unique characters through the journey of WAVi. His dream about 12 years ago started in a primary care physician's office. He went in to go see his doctor, and he thought, well, I'm a little less than, overwhelmed. It's kind of underwhelmed, more or less, is the word I'm looking for. And he thought, well, nobody's doing anything to even measure my brain. They look at my heart rate. I stepped on a scale. They, measured a couple things, but nothing to tell me about. And he goes, well, that's an easy fix. That's like a 3-year project to him. He comes from the particle physics world. And so he was collaborative in 4 different Nobel teams. And he thought, well, this is a 3-year project. You could figure this thing out. He ran into a gentleman by the name of Dave Joffe, and Dave Joffe's the co-founder of the pulse oximeter and had a lot to do with the heart math device out there. And so he was the genius behind the scenes to really help code and get the software to the point where we are right now. And then we run into Scott Siemens, the Crocs founder, to really get that headset to look more like, because there's a lot of headsets out there and they look like, I hate to say it, but they look like torture devices. I wouldn't want my friends or family on them. But this is a 19-array EEG, but it's friendly, it's light, it looks kind of fun. Even for the kids, my kids get scans, my kids' friends get scans, and they think about brain wellness. Imagine if the world, today's youth, right? You have kids, I have kids. If we had a year-over-year brain wellness scan, could the world be a better place?
Sounds like Dave was a real forward thinker and over the horizon, but it's really interesting to think about what the implications are. I mean, we've just sat around, here for the last hour talking about, who would be using something like this. And I know, functional medicine, wellness clinics, performance, athletes, you said you have, you scan whole teams and things like that, for concussions, and I can see all that. Where do you think this has a place kind of in the perioperative medicine, maybe more of an optimization kind of thing for patients?
No question. I mean, I came from the world where you are still in with enhanced recovery. And so, I always wondered if there was a place, and if you're truly optimizing the patients before they go in for their surgery to really improve their post-operative and increase the success rates and keep them out of the hospital and keep them optimized, right? That's really what it is. What if we were to take a look at the brain? I think that there's something there. If you're looking at diet, you're looking at trying to make sure they're tuned up before. And what if we were to get a baseline to see if their brain is optimized, even if maybe they're not ready for surgery? Don't know. Take a peek, 4 minutes, you'll know. And, can you make some changes up until the time of surgery so that you know that they're optimized? And then hopefully you're going to have much better results post-op, right?
Well, Rob, thank you so much for stopping by and chatting with us. This is amazing technology. I'm going to put a picture up for everyone to see me being scanned. I don't know if my brain was that beautiful, but it was better than I thought as a traveling mom. Again, thanks so much. And hopefully we'll be catching up with you soon to hear a little bit more from you and see where this is kind of going in the U.S. And I think it's really exciting stuff. So thanks for stopping by. Thanks for scanning me.
Absolutely. Thanks for having me, Desiree. It's great to see you.
All right. Well, if you guys want to check out WAVi, WAVi, and what's the website? Where can they find out more?
So at wavimed.com, WAV as in Victor, IMED.com.
And of course, I'm sure I follow you all on social media. So tell us where we can find you on that.
Yeah, so on LinkedIn, on Twitter, on Instagram or Facebook. So look up WAVi Med or WAVi Medical, and you'll be able to find us. We post at least 3 times a week. Lots of interesting stories, success stories. I've seen some amazing things happen since I've joined WAVi. So yeah, follow us on social media. It'd be great. Awesome. And if they want to contact anyone from your company directly? So my email is rob.martin, ROB as in boy, .MARTIN at wavimed.com. Awesome. Well, thanks again. And if you have any interest, check it out. There's all kinds of really cool videos online right now that you can see. And they've already done some other podcasts and cool stuff. So check it out. WAVi Med. Thanks for listening, you guys. And we'll catch you next time. Cheers. TopMedTalk. It's Desiree Chappell here. Just a quick reminder, subscribe to TopMedTalk.
We're a daily source of news and conversation focused on perioperative care. We bring you all the latest talk from all the major conferences in the perioperative space. We can also be found on Twitter, Facebook, LinkedIn, Instagram, and we now have a free mailing list with special offers and additional goodies for subscribers. Go check us out at TopMedTalk.com. That's www.topmedtalk.com.